I took 3 lorazepams.
Oh my gosh. This will be a good episode.
And this, like so.
Should we inform the audience that you're
Probably.
live from Lorazepam?
Yeah, that's so good. Welcome to Cancer Convos with Crush and Coconuts.
Yep.
Yeah, it's our second episode.
Woo.
Uh, and today, like I mentioned, we will be discussing fertility.
So my name is Crush, and yep, I live in Washington D.C. and I have triple negative metastatic breast cancer. And you are?
I'm Coconuts, and I was diagnosed with an infiltrating astrocytoma brain tumor, which is a type of glioma. Um, yeah.
And you live in
Oh, I live in Seattle.
Seattle.
Yeah.
Which is why we're on Skype, because we don't live close.
hmm It's true.
Yeah.
So we thought that it would be a really interesting conversation because we have these talks all the time,
Yeah.
just the two of us. And then we started thinking, I wonder if people would appreciate some of the stuff that we've learned. Maybe it could help other patients move along their treatments better and help them be more informed. So today we are really, in my opinion, her story is the cream of the crop. So I'm going to let her take it from there and kind of share what happened
Yeah.
right after diagnosis, right?
Yeah. Well,
Yeah.
and I think it's important to start off with, when you were diagnosed, did anybody say anything to you about your fertility options?
No, they honestly, the only conversations we were getting was that I wasn't going to live long. So
Yeah.
I was like, "Hmm,
Yeah. So nobody even brought it up.
no, not
Yeah.
at all.
Yeah. So, and I think unfortunately, my case is in the minority. I mean, basically the day I was diagnosed, they said, "What is the most important thing to you in this whole cancer journey that you're about to go on?" And I remember saying, "I don't care about keeping my breasts. That doesn't matter to me at all. The most important thing to me is that I keep my fertility." And so they immediately, like the next day, literally, I was in the doctor's office of a fertility specialist. Um, and within, I think, 2 or 3 days, I was starting on my fertility treatment. I gave myself a shot every day. Every day, I had to go into the clinic and have an ultrasound and have my blood drawn. So it was like insanely exhausting and super overwhelming. And I remember my best friend was getting married, and so I had to go up to Maine. I live in Washington, but I had to go up to Maine to for her wedding, and had to drive an hour and a half to the nearest fertility clinic there every day to get the ultrasounds done. And like I had to do it the day of their wedding. I had to do it the day after their wedding. I remember I got a call right before, like literally I was about to walk down the aisle, and my doctor was like, "There's something wrong with your eggs. You have to increase your hormones tonight." And so like later on, I was, after a couple glasses of wine, I was like giving myself more hormones. Like it was it was madness. It was a crazy, crazy time. And it got even crazier because I ended up getting, I think it's called hyperstimulated, which means that um, you basically, if you are producing more than 20 eggs, it's like a lot for your body. Um, and I ended up going to the emergency room the night before they like extracted my eggs because I had 52 eggs. So 20 is like too many, and I had 52. And if you can imagine the pain of like 1 month like PMS, like I had that basically times 52. Like it was probably the most painful thing that's happened to me in this entire cancer process.
Wow.
But that's pretty unusual, so don't be afraid
Yeah.
if you have
And
to go through fertility
sometimes,
treatments.
yeah.
And then the next day, I had my like extraction. I looked like I was like 3 months pregnant for like a week. Like I was so bloated. But everything went well. Out of 52, 25 became embryo. So I have 25 frozen embryo, which I lovingly refer to as my space babies.
It's pretty cute.
Because it feels like it's all like space age technology or something. So yeah, I have a bunch of frozen embryo. And then basically a couple days after that, that took a couple weeks, and then a couple days after that, I started chemo. And ended up being on 9 months of chemo over the course of a year. And I still don't know if if I'm have my fertility back or not.
Mm.
I didn't get my period for 2 years. I was in menopause basically for 2 years, and now I get it, but only very sort of sporadically. So there's basically a number of things going on for young adults. One, our oncologists are not used to treating us, and so people our age, so they don't bring it up in the first place. We don't know it's an issue in the first place. Um, but we also we may lose our fertility. We may be able to keep it, but we should have the right to preserve it if we want in advance.
Hmm.
Um, and then some of us, like you and I, for example, are on these treatments that we don't know if they'll ever end. We both have um, advanced cancers, and we're on sort of immunotherapies and things that we might just have to be on for the rest of our lives.
And you
Um,
can't do, you can either stop that
yeah.
and risk it,
Hmm.
or you can't have, because the treatments that we do, you can't do it and be pregnant.
Yeah. Yeah.
So,
Yeah. So our choices are either to take a pause in our treatments and risk the cancer growing. And then on top of that risk is just this, we just don't know. We have no idea. We don't know how long these treatments will work for. We don't know how long we'll live. We don't know. And like you said, people are really judgmental about, and I think I also have just fears about, if I brought a child into the world, or if I adopted a child, like how long will I be able to be around to be there for that child? And so there's just a lot of unknowns that make it impossible to plan ahead, or think about, like, well, in 2 years I'll be ready. Like, we just don't know. I don't know what's going to happen with our cancers. So what would you say is the biggest challenge for you in your life dealing with just all the unknowns and difficulties with fertility and cancer?
I wish that I would have had the opportunity to harvest and store my eggs and perhaps even get create an embryo with Dan, because we were together in love, and he had already proposed. The second I got diagnosed, he proposed, and it was full love.
Yeah.
And I'm not, with all the drugs I've taken and the things that I don't even know if those eggs are viable, you know?
Yeah.
So that's really sad to me. And then as this evolves and I'm doing better and better, it is really, it's this like half and half. I am so in love with my friends' children, and I'm so, so happy for them. And then I go home sometimes and I just cry to Danny.
Mm-hmm.
And I feel so bad, but it's just like it hurts your heart because it's the dream you always had. You want to snuggle up with these little kids and have their life, have your whole life turn into be all about them. Like, I'm so sick of it being all about me. Oh, it just hurts. I mean, it's like I'm having a hard time not crying.
Yeah.
What about you?
um, I mean, I think that, yeah, I think I've gone through this thing where almost all of my friends are getting pregnant. It's like you go on Facebook and there's a new pregnancy announcement every day, and it's just filled with photos of babies, and just there's just a part of you that just, I mean, I have always wanted to be a mother. That's like all I ever wanted, and my mom was a midwife. Like, I grew up surrounded by babies, and there's just some part of you that just feels super left out, like you just feel like I can't relate to anything. Like, there's now
Mhm.
this whole group of women in my life who can't talk to me um, about what they're going through. Yeah, I don't know. How do you deal with your friend's pregnancy?
I just I avoided everyone for a while.
Yeah, yeah.
I wouldn't go because I was like, Dan, I can't. Like I would just start crying. I'd be like, I can't go. I love these girls, and they've been so wonderful to me. They've done nothing. They've been nothing but kind and just gracious and funny. And I couldn't. I didn't want to bring it down because it wasn't about me. It was about their joy. And even though I have joy for them, I also have just as equal amount of pain
Yeah.
because I'm so sad.
Yeah.
I
Yeah.
mean, Dan has like come home to find me just curled up on the couch, just sobbing.
Yeah.
It's not every day, but every once in a while it hurts.
Yeah.
And you couple that with like any type of scan result, and you're like, oh, well, good. I'm glad I dodged a bullet. Maybe I'm not supposed to be a mom. And then if I'm not supposed to be a mom, but I might live, what is my life going to look like?
Yeah. 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 It's hard to feel like you have a sense of where you're going to get your fulfillment from. And like, okay, so I live to be 50 or 60, and then what? Like, I have um like I have no grandkids, I have no kids. I'm not like everyone I know will be sending their kids off to college, and like it'll just be me and Andrew. And it's not like I don't feel like I can have a fulfilling life, or like have a good life with Andrew, but it just feels like there's this huge thing missing. Um
Yeah.
yeah. I think the reasons that I feel like I've had to work really hard to try to let go of this idea of motherhood
Hmm.
is that, like, one, I don't know, it seems impossible that I would be able to have a child naturally at this point.
Hmm.
And even if I could, I don't think that I would feel comfortable getting off treatments long enough. And, like we said, our treatments might go on forever. We have no idea. Um, it's hard to, it's not impossible, but it can be difficult to adopt, particularly when you have advanced cancer. A lot of adoption agencies, like, you have to have a doctor sign a bill of health saying, like,
Hmm.
you're healthy, and I don't think a doctor would sign that for me. So, and like, I could have a surrogate, but um, paying a surrogate is just like, I spend almost $200,000 a year on my treatments because they're all out of pocket, and insurance doesn't cover any of them. And a surrogate's like $60,000 to $80,000. I just don't have that kind of money, and I don't think I'll ever have that kind of money. So yeah, it's just hard to feel like it's a possibility, and so I really work hard to like try to let it go. Like, it's the hardest thing in the world to let go of, but
Yeah.
But I think one thing that finally clicked for me is that I was like constantly fighting and constantly feeling so much grief about my inability to have children and to be having children like right now. Like, it felt so immediate, and like um and
Mm.
I think for one, I sort of have accepted that I live in this space of just not knowing. Like, I don't know if I'll live, I don't know if I'll die, I don't know if I'll have kids, and so my life is just sort of always up in the air. And so I think I've learned to come to some place of acceptance with that. Um, and um, but the other thing is, I've just tried to be really kind to myself. And I basically every night I meditate, and I do a lot of it's called metta meditation, which is like loving kindness meditation. And I started just directing it at myself, and sort of came to the realization that the problem was not just that I can't get pregnant or can't have kids, but the problem was that I actually felt really unworthy in society as a woman, of childbearing age.
Hallelujah. I swear
Yeah.
to God. It's the worst feeling. I'm like, well, I'm completely useless.
Yeah, like, yeah, I mean, everywhere it's like everything's about moms, everything's about, and like breastfeeding, like you're
Yeah.
only a real woman if you can breastfeed, and like even if I had kids, I couldn't do that. So I just basically in these meditations started saying, like, you are worthy even if you can't have children. And I did not Like the first time I did it, I just sobbed for like 10 minutes and was like, this is bullshit. I don't believe myself at all. But I think that notion sort of finally started to set in, and I started to, see the ways in which I am sort of get to use those mothering instincts in other places, like with my dog, my dumb little dog, and like with organizations that I volunteer for, and with this, like with trying to help other young adult cancer patients. I think
Yeah.
those are all sort of instincts, about
Using your motherly, energy to
yeah,
help soothe and help other people evolve in a positive way.
yeah, yeah, and be empowered and
Hmm.
yeah, it's not the same. Obviously, it's not the same. And there's still a ton that I feel like I'm missing out on all the time. But, um, but,
It's true.
but like I can accept now that I am worthy without, without this one thing in my life right now. Like I can't say how I'll feel in 5 years. But like for today, like I can feel okay about myself and my life, and I think that's the most important thing for anybody. I mean, like, and it's not just cancer patients that deal with fertility problems, right?
Right. No, not at all.
Millions of women.
I've
So,
had a few people reach out to me about it. Um, yeah, and it was really funny. The interesting, we had so much in common. They didn't have cancer, but there's a grief
yeah,
um, that goes with it. It's just a painful thing. My final thought is that it's very important to talk to your doctor when you first get diagnosed and they're going to be recommending any sort of treatment to be referred to a fertility specialist to learn your options. You don't have to go through any of it, but you need to know what your options are because your treatments may last for a long time and you just deserve to be able to make that decision if it's something you want to do up front or if you don't want to worry about it till later. But
yeah,
it's important to have all the knowledge.
yeah. Know what your options are and know what the consequences of your treatments will be.
Yes, that's a good point.
Yeah. Um, yeah, I think my advice would just be to be gentle with yourself, be kind to yourself. Obviously, this is really difficult. And I've just experienced a lot of grief and a lot of guilt, and
Hmm.
it's it's just a hard thing to go through, and just know that, and know that that's okay, and that you're not alone. There's people like us out there. There's millions of us, and then there's millions of women who just have a hard time getting pregnant. Period. So we're not in the mommy club, even though we want to be. But that's okay, and you are a worthy, worthwhile human being, whether or not you can reproduce. Um, so that would be my final thought.
I think if I could just tweak it, or I guess add this one little thing, the longer I go, it was so painful, but the longer I go, the more I realize not everything has to happen right now.
Yeah,
And I'm 35 and I may adopt at 45 and my cancer may be continuously stable. I may be able to save some money during that time and be able to afford an open-ended adoption or any kind of adoption and
yeah,
um, there's still more hope. There's always hope. You cannot just take everything at face value because
yeah.
nobody has all the answers.
No. All
Gotta
right.
lean on, and we gotta lean on our friends.
Yeah, yeah, exactly.
That is for sure.
Yeah. Yeah, find your tribe of
Hmm.
women and men and family and friends who will support you.
Hmm.
Totally. Yeah. Um, so yeah,
Yay.
episode 2. It was
It
emotional.
was.
But thanks everybody who watched our first episode,
Yeah, thank you
and
so much.
thanks for watching this one. And if you have your own story with fertility issues, please share it in the comments, or go to our blogs and get in touch with us. We'd love to hear from you. And stay tuned for more episodes. We're going to talk more about fertility and options for adopting and surrogacy and having your own babies and all that stuff in future episodes. So
Yeah.
stay tuned.
Stay tuned. Thanks again, you guys. We love you.
Yes. Love you all. Love you, coconuts.
Love you, crushers. The only thing I regret is that I haven't been very funny.
It's a hard day to be funny. It's a hard topic for humor.
Yep.
It's okay. We'll be funny another episode.
Okay.